We are a 2110 CCR recipient, along with Washington State University Partnership, or WASEP. Before we begin today, please know that today's webinar is being recorded. We would also like for you to know that we have interpretation, as Zoe just mentioned, throughout the duration of the webinar. Today, we are pleased to have with us two interpreters, Maria Pape and Natalia Rivera. I'd like to again share instructions on how to engage in the English or Spanish channel if you're interested. On the bottom menu in the Zoom window, there's a globe icon that says Interpretation. Click on that icon and select your preferred language. Also, a friendly reminder to our speakers to speak slowly and clearly, giving Natalia and Maria time to interpret. Next slide, please. Now we will go ahead and get started. Thank you all again for taking time to be with us. Today's webinar is part of the Community Health Workers for COVID Response and Resilient Communities, or CCR as we like to call it, program. CCR is a CDC initiative launched in 2021 to support the training and deployment of community health workers to strengthen community resilience and address health disparities to fight against COVID-19. If anyone would like more information about the CCR program, you can click on the link provided in the chat box to find more information. The link has now been placed in the chat. Now, I have the esteemed honor of introducing today's speakers, Doctors Ibe and Mayfield-Johnson, who will co-present throughout the duration of the presentation. Dr. Chidima Ibe will be one of our presenters. Dr. Ibe is a social behavioral scientist with primary interests related to developing and testing community-based interventions to reduce disparities in cardiovascular diseases in populations experiencing social marginalization. She's core faculty in the Johns Hopkins Center for Health Equity and serves as its Associate Director for Community Engagement, which is aligned with her passion for community-engaged research and practice. She's also an assistant professor in the Department of Medicine, Division of Internal Medicine at the Johns Hopkins School of Medicine, and also holds a joint appointment in the Department of Health, Behavior, and Society at the Johns Hopkins Bloomberg School of Public Health. Dr. Ibe has partnered with community health workers and CHW allies to explore facets of CHW model for over 20 years, with a particular focus on the role of CHW-led interventions and supporting cardiovascular disease self-management among members of structurally disadvantaged communities. Next slide, please. Dr. Susan Mayfield-Johnson, who will join her, is an associate professor for the Dr. Lynn Cook Hartwig Public Health Program at the University of Southern Mississippi. She served as a CHW ally for over 25 years. Her area of research focuses on community health workers, racially diverse and underserved populations, health disparities, and qualitative research designs. She has a strong commitment to community engagement in public health educational programs and practice in participatory action research for improving community health. We are certainly thankful to both Susan and Chidima for being with us today to share their expertise in Photovoice. We also want to thank the CDC and CHW Center for Research and Evaluation for their support as well. At this time, I'd like to turn it over to my colleague, Zoe Somerville, who will share our goal and objectives for this webinar, review ASU's land acknowledgement, code of care, and other important updates. Zoe?
Thank you, Dana. So starting with our webinar agenda, we'll have an overview of what Photovoice is, methodology, and then specific examples of Photovoice being used with CHWs, then go over best practices, and then end with a question and answer session. So this is our Arizona State University's Office of Community Health, Engagement, and Resiliency acknowledges the 22 Native nations that have inhabited this land for centuries. Arizona State University's 4 campuses are located in the Salt River Valley on ancestral territories of indigenous peoples, including the Acoma O'odham and Peepash Indian communities, whose care and keeping of these lands allow us to be here today. Please stick around for information about upcoming webinars at the end of today's presentation. At that time, I will share registration links in the chat. Lastly, please remember that AMP is where you will find information about the CCR project and where you can make TA requests for assistance with your project's evaluation, including follow-up on any information or topics we talk about today. Here's our code of care for today's presentation. I'll highlight a few important things to remember. First, you're welcome to introduce yourself in the chat and share what organization you're working with. Please use the Q&A throughout the presentation to post questions and, if possible, to whom you're asking your question. And lastly, please take care of yourself. If you need to step away for any reason, please do. A recording of today's webinar will be uploaded to AMP. And with that, I will go ahead and turn over the presentation to our presenters.
Thank you so much, Zoe and Dr. Hunter. We're so honored to be able to be here with you this afternoon to discuss innovative qualitative methods to evaluate community-based projects. And as you can see from this slide, we'll be focusing on Photovoice. Thanks. So to begin, Photovoice falls under the realm of participatory research. Participatory research can be thought of as encompassing methods and a philosophical orientation that flips the standard way of conducting research. In participatory research, study participants who historically have been regarded as research subjects become involved as partners in the research process. Participatory research is geared toward fostering bidirectional learning and capacity building. And Photovoice deepens this idea of co-creating knowledge and building a shared understanding of a specific phenomenon through photography. Those who participate in Photovoice studies or projects use pictures and dialogue to discuss their community's strengths, needs, and the barriers and facilitators of social change that operate across multiple levels. Next slide. There are several core beliefs that serve as the foundation for Photovoice, and we're in this presentation going to touch on a few of them. The first is that images teach and inform. The second core belief is that pictures can influence policy because they illuminate the realities of those who take the pictures. The other belief that underlies Photovoice is that community members should participate in creating and defining the images that shape the policies and practices that directly affect them. And we believe this to be important for many reasons. One of them is that structural factors shape the social determinants of health that influence the ways in which we navigate the world. And most public policies and practices tend to target adverse social determinants of health, also known as social risk factors. They're frequently created, these policies are created by those who do not or have not experienced social risk factors. In contrast, Photovoice positions community members as experts in shaping our understanding of how social, economic, and political factors converge in a way that positively or negatively affects different communities or populations. And the last point, that individual and community action is necessary to affect change, harkens to the previous point that was just raised. It also underscores that one of the primary goals of participatory research at large, and especially Photovoice, is that research can and should mobilize individuals, families, and communities to work together to affect change. Next slide.
Here we will discuss some of the goals and objectives of Photovoice. Next slide, please. Photovoice has three main goals. One is to help those who are often unheard gain a voice, enabling them to record and reflect on their experiences and their community's conditions, both positive and negative. Another is to encourage critical consciousness. Through discussing and choosing and reflecting on the subjects of their photographs, the photographers can come to a clearer understanding of their circumstances and the economic, social, psychological, and political forces that often shape them. Finally, Photovoice sets to bring about change that will improve conditions and enhance lives by reaching and influencing policymakers. Just a note, the term critical consciousness comes from the work of the Brazilian literacy educator, Paulo Freire. Freire used the term critical consciousness to refer to the process of those who are oppressed using critical thinking about their own situation. By analyzing the forces shaping their circumstances, the first step towards bringing about change is this. Next slide, please. Photovoice is an appealing methodology to employ for several reasons. One is that immediate rewards are often given to those who participate. Those who participate in a Photovoice project have the opportunity to showcase the world through their eyes and to articulate why the images they took are meaningful to them. This can be a gratifying exercise for those who take the pictures, those who participate in the discussion about the pictures, and those who facilitate discussions regarding about what the picture means. Another one is that photography is a very creative exercise. Photography can be fun, creative, and accessible. The rise in popularity of smartphones, most of which have the capacity to take pictures, has made it so that anyone can become a photographer. Photovoice offers an opportunity to channel something that is already popular into an activity that is both fun and substantive, with respect to the subjects being highlighted through the images and the ensuing discussions. Pictures that we take often have meaning to us. Photovoice is a method rooted in deriving meaning from things that may seem ordinary or may be considered mundane. Because it is a group-based endeavor, pictures taken through Photovoice provide an opportunity for bidirectional learning and mutual capacity building with respect to showing others' perceptions of the world around them. So this is how Photovoice illustrates current perceptions. Photovoice also facilitates empowerment, skill building, and critical awareness of one's community. A study by Buddig and his colleagues, published in 2018 and based in Spain, suggested that those who participated in a Photovoice project reported positive changes in 3 dimensions of empowerment. One is that participants acquired new knowledge and developed critical awareness of their community. The second is that the social recognition participants received transformed their self-perception. And finally, the project allowed them to expand their social networks and to build new links with different actors. And that may include research partners, local decision makers, the media, and even the wider public. In many ways, Photovoice pulls people out of their own worlds and offers them a chance to transform their perception of common realities. And finally, images can be understood regardless of language, culture, or other factors. Although we may have associated images established with certain pictures, individuals can recognize and see an image and make meaning regardless of language, culture, and time, amongst other factors. Next slide, please. So when should you use Photovoice? Photovoice can be used when it is necessary to change people's opinions about themselves and their environment. Think about when participants are members of a population that has traditionally been considered powerless, like rural villagers in some developing countries, or people at the bottom of the socioeconomic ladder. The Photovoice experience can change a perspective and goals in which it makes it possible for them to improve their lives. An example of this is the Language of Light Photovoice project, which was done to enable men and women living in a shelter in Ann Arbor, Michigan, to photograph their everyday health, their work, and their life conditions as a way to document their struggles and strengths to reach policymakers and the broader public about issues of concern to homeless individuals. Next slide, please. Photovoice can also be done when we're looking to develop a group situation that needs to be publicized. Groups range from people in refugee camps in war-torn regions of countries experiencing political upheaval, or to individuals maybe that are unhoused, navigating life in high-income countries, or to seafood and fishing communities impacted by natural and man-made disasters. Photovoice might be particularly relevant in the case where whose plight is largely known to the outside local areas. An example of this was the Describing Vulnerability and Resiliency study done with the Vietnamese community along the Mississippi Gulf Coast in Mississippi. Research has shown that economic fragility is often the greatest vulnerability to Vietnamese population members. However, there has been little research that has looked at strengths and risks as defined by Vietnamese community members from first generation, second generation, and subsequently third generation in countries where they were not born. This particular study looked at health risks and health resiliency amongst Vietnamese members from a cultural and generational perspective. Next slide, please. Excuse me 1 second. Although another reason for Photovoice is when you need to publicize or prioritize a problem or an issue, like trash littering a neighborhood due to erratic garbage collection, substandard housing, and hypersegregation, occupational hazards faced by community health workers. These are all problems that can be highlighted by photos taken by those who live with them. As many of you are aware, community health workers are frontline public health personnel who share common attributes with or have a nuanced understanding of the communities they serve. Their membership in marginalized communities gives them expertise in delivering contextualized interventions that mitigate their clients' social risk factors, but it also places them at a greater risk for exposure to various harms. A study in Baltimore, Maryland employed the Photovoice method to illuminate how the lived experience of community health workers working, residing, or both in Baltimore City, Maryland, dovetail with facets of their jobs. In partnership with 16 predominantly racial and ethnic minoritized study participants, researchers surfaced the ways in which community health workers negotiated and subsequently leveraged their experiences with social risk factors rooted in structural racism to shape the approach to intervention delivery for structurally vulnerable communities. Next slide, please. When change is necessary, Photovoice can help inform policymakers. An example of this is when the Rutgers University Health Services Department of Health Education used the National College Health Assessment data and Photovoice to further assess student lives and health needs. Through Photovoice, healthcare professionals provided a discrete and tangible way for students to feel empowered as students conducted the project themselves. They collected data using photography. They analyzed the results qualitatively. They met with policymakers to discuss their photos, and they offered recommendations for change. Policy recommendations addressed included issues of safety, nutrition, sexual health information, alcohol and drugs, and campus parking. Next slide, please. Photovoice can be used when you need to document the process of or gather data for an evaluation of an intervention or program. Photovoice participants can picture results, record interviews, demonstrate their own opinions about the intervention. As change agents in the community health advisors are a viable solution to bridge the gap between health service delivery systems and the community. With many community health advisors as members of underserved and minority populations that they serve, change and empowerment experienced by these individuals should also be documented. We tend to only look at the community that we're looking at, but we fail to often look at those who help change the systems. This phenomenological study described the empowerment change process of 30 African-American community health advisors who participated in focus groups that used Photovoice and were part of a breast and cervical cancer health promotion program in Mississippi and Alabama. Using photos and narratives as primary research methods, these community health advisors gave voice to an often overlooked resource in the community of vulnerable populations and in the education and promotion of the community's health. Next slide, please. Photovoice can also be used when a community assessment is needed or in progress. Community members know their own community, and they know its needs and its assets. Their photos can document community conditions, which often can play an important role in clarifying areas of strength and opportunities for improvement. An example of this is a youth Photovoice project conducted in rural Morgan County, Kentucky, that engaged high school students in a comprehensive visual community health assessment. Participants in this project were asked to capture community characteristics that affect residents' health through the images and the lens of a camera. They were also asked to provide narratives about the pictures they captured. Participants could identify potential community assets as well as changes that can improve their community. Photographs covered an array of topics that ranged from a broad illustration of the community to specific health concerns related to food security and obesity. Next slide, please. And finally, Photovoice can be utilized when you need to hold policymakers or others accountable, or when you need to document a site, an event, or a way of life that is threatened or about to disappear. An example noted in a study with tribal members from the American Indian community in the Midwestern United States, where they used Photovoice to document their perceptions and beliefs about water and health on their reservation. The study infused Photovoice's seminal theoretical influences within an environmental justice framework to explore the impact of environmental change in water on human health and well-being within the cultural realities of a tribal community. Study findings detailed how water is fundamental to the lives of our tribal nations and American Indian study participants, and it exposed the scope of health concerns they have related to water circumstances on their own reservations. Next slide, please.
So at this point, we're sure that you're now wondering, how exactly do you execute a Photovoice project or study from start to finish? And that's what we'll spend the next few slides discussing. Next slide, please. So what you see on this particular slide are the first two steps entailed in the Photovoice process. These steps will occur after you've recruited and consented participants for your project, and we've used these steps in our own work. One of the things that I want to point out is that Photovoice training must be conducted with study participants prior to taking photographs and initiating discussions. And this typically occurs in the first session of your time together. The first session of the Photovoice process really lays the foundation for the entire experience. The goal is to ensure that study participants or project participants understand what the Photovoice method is, why it was selected, and the research questions that are guiding the study or project. Another important goal of the first session and in this first step is to encourage participants to use their creativity, their knowledge, and experience to capture study concepts through photographs. Within the first step, in addition to sharing the rationale for using Photovoice and sharing the research questions as well as training participants, is highlighting the goals and methods and the advantages and disadvantages of Photovoice, as well as the process of using a camera or a disposable camera and or a smartphone, depending on the study or the project. It's also important that within this first step that you establish clear guidelines around what can be included in the pictures. If your project involves taking pictures with people's faces, make sure to review and discuss the informed consent process with your participants, meaning the consent form for project participation, and ensuring that they understand that they need to obtain permission from any individual prior to taking their picture. This is really going to depend on the study. In the study that my colleagues and I did, our participants weren't actually allowed to take any pictures that included identifiable information, such as people's faces or their addresses. In other studies, such as the ones that Susan has led, their study participants were instructed to obtain informed consent from those they took pictures of. But the main takeaway is to be very clear on what the rules are for your specific study or project. If your study does include pictures of individuals, make sure that in this first session, you include role playing so that you can role play how to obtain informed consent. This will allow the study participants to feel more comfortable learning how to do this so that they can actually execute these strategies when it comes time for them to take pictures. We also encourage you within this first step, meaning the first session, to model the transparency that characterizes participatory research. What we mean is be sure to discuss the ethical considerations, the personal boundaries, and personal safety strategies that participants may need to adhere to. Also, be sure within this first session to set aside time for brainstorming, to discuss concepts related to the study topics, to get participants thinking about the kinds of pictures they would like to take. Now, step 2 marks the point at which study participants will start taking pictures. And the best way to support them in this process is to provide clear guidance on where to take the pictures based on the main issue or research question you're addressing, and to make yourself available to answer any questions or address concerns that may come up. Next slide. Now, the next set of sessions are when the Photovoice project will be up and running in earnest. Typically, a Photovoice project occurs over 5 to 7 sessions, and the frequency with which you meet will really depend on your bandwidth, the availability of your participants, and other key factors that are going to dictate the level of engagement you can realistically expect. The first session, which we just touched on, is really, again, devoted to describing the Photovoice process and acquainting study participants with all of the specifics mentioned in the previous slide. The next set of sessions will get into what are really the meat and potatoes of the Photovoice process. And these sessions are going to follow a very similar format in terms of their structure. You will start off by asking each participant which pictures they want to discuss in that particular session. Now, depending on the length of the session itself and the number of participants, you may want to ask them to limit the number of pictures they show or want to review to maybe their top 3 to 5 pictures. And one thing that we want to make note of is that as the Photovoice project proceeds, participants will probably naturally start to winnow down how many pictures they display and want to discuss. You'll also go through the SHOWed framework for each picture. The SHOWed framework was developed by Dr. Carolyn Wang and colleagues, and it's an acronym, as you can see in the blue box. Each letter represents a question. S is for what do we see here? H is for what is really happening here? O is for how does this relate to our lives? W is for why does this situation, concern, or strength exist? And D is for what can we do about it? So you will go through the SHOWed framework each time you meet with each image that you review. And by the 3rd or 4th session, most participants will know the SHOWed framework very well. They might actually get sick of it, but that's okay. The other thing is to ensure that you practice active listening as you facilitate the discussion. So listen intently to what participants are sharing about their pictures and their responses to the questions. Summarize what they shared and summarize some of the main themes that emerged in the discussion. And we do want to make note that this is where having a co-facilitator or an assistant facilitator comes into play. They can help take notes on what is being discussed. You will also want to ensure that you discuss the previous session's themes. This is going to help you as the facilitator keep track of potential shifts in perspectives that occur among the group. It can also help you see if there are certain beliefs that either become deeper entrenched, or if a more nuanced understanding of that specific issue that the Photovoice project is covering starts to take shape. And it tends to be a great way of maintaining a through line between the sessions. Next slide, please. Step 4 pertains to the last Photovoice session. This is a time to celebrate a major achievement. The group has taken their pictures. They've had rich discussions that really clarified what the issue at hand was. And so this last session is a perfect opportunity to ask participants what they thought about their experience, the lessons that they learned, and areas for improvement. It's also when you will start to concretely map out the next steps, the part that leads into step 5, disseminating the findings through a stakeholder meeting or through other forms of dissemination. Step 5, to the point that I just mentioned, is all about dissemination. So as Susan and I have been trying to emphasize, Photovoice is really geared toward promoting changes in public policies and practices. It's an essential aspect of the Photovoice process. And this will happen through the community photo exhibit, among other dissemination strategies that Susan will touch on in a minute. As with anything related to dissemination or sustainability, ideally, you and your participants should actually start talking about strategizing around and planning for the photograph exhibit actually at the beginning of the Photovoice study or project. This will really help the group come to consensus about the main topics they want to highlight in the community exhibit. Together, as you plan for this exhibition, you can decide who you want to invite, which stakeholder groups or community groups should be engaged to promote a policy agenda, how to reach out to specific policymakers, and how working together can be done in a way that can lead to changes in the community around the topic that was elucidated through the Photovoice process. Next slide.
Just as Chidema discussed, dissemination of information is imperative and will often happen through a community photo exhibition, among other dissemination strategies. Remember early in the presentation, we noted that one of the goals of Photovoice is for policy advocacy and to bring about change that will improve conditions and enhance lives by reaching and influencing policymakers. In the first 2 pictures here from the left, you will see a community photo exhibition that was the culmination of a maternal child health needs assessment conducted in Mombasa, Kenya. An international fellow with Aga Khan Academy was placed at the Institute for Disability Studies at the University of Southern Mississippi. She was interested in developing a pilot program to serve intellectually and developmentally, disabilities in children. When discussing the community's priority need for a pilot program to clinically serve children with intellectual and developmental disabilities, the question came up about understanding the priority needs of residents in the Tananaka ward and having partnership with local tribal leaders. As a result, a maternal and child health assessment was conducted. I apologize, everybody. We have a friend here who wanted to participate in the presentation. Excuse me. As a result, a maternal, child, and health assessment was developed in partnership with the Aga Khan Academy, their inbound fellow, local tribal leaders, madrasas, and community health workers in the Tananaka ward of Mombasa through Photovoice and to train community health workers in core skills and outreach. For those of you who may not know, Mombasa is the port city on the coast of Kenya, and madrasa is an Arabic word for any type of educational institution, whether secular or religious, of any religion, whether for elementary education or higher learning. The community photo exhibition was blessed by the tribal leaders and displayed photos from community health workers working in maternal and child health. It was set in the heart of the community, with the Ministry of Health serving as a keynote speaker, ministry governmental employees, local community members, and local media attending. Community health workers who participated in the show discussion were by their pictures and captions and discussed the community's needs with members of the community who were attending the Photovoice exhibition. And they were helped to serve to help identify what issues were a priority to the community. Another way to disseminate is to have professional presentations at scientific conferences. The last picture here on the right are community health workers attending the American Public Health Association annual meeting and inviting the principal investigators, the funders, and government officials to the presentation to share what was learned. It's just important to also note that the Vietnamese Vulnerability and Resiliency Study also had a community photo exhibition at the Gulf Coast Seafood Museum, where participants in the study shared their pictures and discussion with members of the community, local community-based organizations, and elected officials to bring the knowledge learned to build individual and community capacity. Next slide, please.
Sorry, after all this time and many, at this point, years on Zoom, I sometimes forget that I'm on mute. So in addition to the wonderful examples that Susan shared of her dissemination strategies and the approaches she used in her work, we also wanted to highlight a study that was done of an example of a community health worker-centered Photovoice project, the Amplifying the Lived Experiences of Community Health Workers, or ALEC study. Next slide. So this particular study was conducted by myself and colleagues based at the Johns Hopkins Center for Health Equity in collaboration with the Maryland Community Health Worker Association. And it was really geared toward uplifting community health workers' perspectives through Photovoice. We were guided by the following objectives. We wanted to explore community health workers' lived experiences and their own encounters with social risk factors, both professionally and personally. We also wanted to illuminate the ways in which community health workers' personal experiences affect their approaches to intervention provision. Finally, we wanted to learn from community health workers themselves how their intersecting identities affect how they're perceived by the people they work with and the community members they support. And I want to note that the picture that you see here is from an ALEC study participant. Next slide. The overview of the ALEC study is pretty straightforward in terms of its study period, its inclusion criteria, the recruitment, and participants, those who ended up participating in the project. The study was conducted last year from March of 2022 to July, and based on the recommendation of one of the co-investigators, who is the president of the Maryland Community Health Worker Association, we agreed that to be eligible to participate, those who wanted to do so had to be at least 18 years of age. They had to be a practicing community health worker for at least 2 years. They had to reside in and/or work in Baltimore City, and they had to be English or bilingual English or Spanish in terms of their language abilities. To recruit participants, we targeted outreach to Latinx community health workers through employers' listservs. We also made presentations to members of the Maryland Community Health Worker Association during their monthly meetings. we also sent recruitment emails through the association's listserv. Ultimately, we consented 19 community health workers to participate, 16 of whom participated in at least 3 of the 5 Photovoice sessions. We divided the group into 4 cohorts, one of which was dedicated solely to Latina community health workers. Study participants within each cohort met once a week over a 5-week period. Next slide, please. As I mentioned before, the Photovoice sessions were held virtually over Zoom. They were conducted in the evenings during the work week to accommodate our participants' schedules. The first session, which we alluded to when we talked through the nuts and bolts of how to conduct a Photovoice study, was centered on orienting the participants to the study and receiving a training in photography from a professional photographer who provided guidance on how to use the cameras. As an aside, we purchased the cameras and gave each community health worker a camera to use, which they then returned to us upon their completion in the study. In sessions 2 through 5, we reviewed and discussed the photographs that were taken by the ALEC study participants using the SHOWED framework as a mechanism for facilitating the group discussions about the pictures. Next slide. When we undertook an analysis of the data, meaning that we recorded the Photovoice sessions and had them professionally transcribed, we saw 4 themes that emerged. The first was we saw that participants indicated that community health workers' experiences with social risk factors and health-related social needs were both personal and professional. The second theme we saw was this idea of community health workers exhibiting a socio-emotional connection to their roles, which affected their approach to intervention delivery. The third theme that we saw through these discussions was that community health workers exhibited a very nuanced understanding of the limits and weaknesses of social risk factor interventions, especially the prevailing ones that are typically used in public health programming. And finally, our fourth theme was the emergence or the recognition of a range of unique occupational hazards that they face as community health workers. Next slide. For the sake of time, we'll focus on 2 of the themes. One of the interesting things about this particular theme was the ways in which we learned about the interplay between structural and interpersonal racism through the community health workers' experiences. As an aside, one of the definitions of structural racism that was highly relevant for this study is structural racism being the totality of ways in which societies foster racial discrimination through mutually reinforcing systems of housing, education, employment, earnings, benefits, credit, media, healthcare, and criminal justice, and how these patterns and practices reinforce discriminatory beliefs and values and the distribution of resources. Precisely because of who many community health workers are in terms of their social identities, that they identify, for example, as Black or Latina, and that the majority describe themselves as women, what we learned from the community health workers through this first theme is that many CHWs experience racism from the structures they're embedded in terms of their communities, their roles, the people they support, and their own personal lives. And they are also confronting interpersonal racism from the individuals they're trying to help or the colleagues they work with. The image that you see here highlights the tensions that community health workers experience living in neighborhoods that that are victims of systematic disinvestment. Next slide. And as I just mentioned, one of the things that came out was this notion of interpersonal racism posing as a unique occupational hazard that community health workers faced. There were other hazards that they discussed. They talked about safety concerns. They talked about vicarious trauma. They also talked about the financial instability that accompanies their roles, since many of them are grant funded. But again, interpersonal racism was one of the other things that they reported experiencing. And they used the images they took to really shed light on what that meant for them. I'm not sure if you can see it, but what this sign actually says is "close the border." And the quote that you see here is from a Latina community health worker who is describing the experiences of discrimination they faced personally and professionally. Next slide. So we will conclude our time by talking about some of the best practices for Photovoice studies that we've observed from our experiences and have learned from other colleagues who have undertaken this work. Next slide. First, we want to highlight guiding values and ethics during the Photovoice process. That respect, transparency, emotional safety, and grace are really critical. Respecting or cultivating an environment or a culture of respect within the group so that people's individual thoughts, opinions, and feelings are respected. Transparency with respect to being open and honest with each other. Creating an environment of emotional safety so that all of the members of the Photovoice group commit to refraining from discussing what the group talked about during their sessions with others who are not part of the group. And grace, maintaining grace and compassion for one another as the group learns new things together, which is of particular relevance given that many of the topics that tend to come up in Photovoice discussions tend to be emotionally fraught and can be controversial. Next slide.
Guiding values we want to also share with you are that it is important to provide feedback, to share the results, and consider co-presentation and co-authorship. We want to include that it is our responsibility to report back the data analyzed and findings with the participants who participated in the study. We have a responsibility to share what we learned with those individuals who gave their time, their experiences, their perspectives, and their intellectual property with us, and to illustrate how we will demonstrate these findings from these sessions to the larger public and scientific community. We also need to make sure we provide an informational session with local community members who were impacted by this research. Not only do we build capacity in the community, we also provide insight from what was learned. Many community members may not have access to some of the journals that researchers typically report findings in, so an informational session and sharing of results is necessary with community members. And we also feel very strongly about co-presentation at scientific meetings and co-authorship of manuscripts with the individuals who share their vulnerabilities and their strengths with us. Community health workers and other participants should participate in creating and defining the presentations and the manuscripts that shape and inform public policy about them. There's a saying that community health workers say, "Not about us, without us." And that is important for us to maintain. Next slide, please. Well, we hope you've enjoyed an overview of Photovoice, and we did want to provide some disclosures of our funding sources for the research that we share today, and to note that the contents of this presentation are solely the responsibility of the authors and do not necessarily represent any official views from the National Institutes of Health. Thank you.
Thank you so much to our presenters for sharing their expertise on these topics. I'd like to open up the floor to any questions. Feel free to post your questions in the Q&A if you haven't already. Okay, this question is from Andrew. Could you share more about how Photovoice co-investigators would request consent of participants for whom you will be taking photos?
In one of the studies that I did, I was asking about change and how change has impacted you and what change actually means. And for this particular study, I had utilized a Black Feminist Theoretical Foundation because it was really important to honor the words and the images by Black women for Black women. And many of the women wanted to take pictures of people who were important to them. So we discussed in the Photovoice training session the necessariness of having an informed consent for taking pictures of someone. And we practiced role-playing activities where you would talk to someone about how you would like to take their picture and get their consent. The consent form included where they would need to sign off that they did give consent for their pictures. This is really important because I don't want anyone to take pictures of someone as a subject and dehumanize any individual in any way. We want to illuminate, we want to support, and we want to draw attention to needs that exist, but we do not want to in any way put someone on the spot and ask them to take a picture without their permission. So we practice that because that particular study was really looking at it from an individual and community perspective. We were able to do that. A consent form was developed, and I'm happy to share that with you if you'd like to email me to do that, and even some of the ways that we did the training related to that particular study. I hope that answers your question.
Thank you. All right, the next question is from Noel. Could you talk about the connections between Photovoice and popular education philosophy and methodology, which is also associated with Paulo Freire?
I will start in answering, but I also hope that Susan will jump in because she has a lot of expertise in this arena. And thank you for that great question, Noel. I really appreciate you asking that because Paulo Freire's principles are at the root of participatory research at large. And I would also extend that further to suggest that other Black female intersectional philosophers, bell hooks is another one that comes to mind, could also be thought of as really playing an essential role in kind of shoring up the philosophical underpinnings of participatory research. But when I think about Photovoice, I think what Photovoice does is it really, for those who are not as familiar with Paulo Freire, Susan mentioned him earlier that he was a Brazilian educator and education scholar. And one of the things that he championed in his seminal book, Pedagogy of the Oppressed, is this idea that the best way to combat the prevailing paradigm of teaching, which he referred to as the banking model, was to disrupt that by acknowledging that those who are the students are just as knowledgeable as the people teaching them. and to really endorse this idea of co-learning and co-creation, which is at the heart of participatory research. So when I think about the connection between Photovoice and popular education philosophy and methodology, which is again rooted in Paulo Freire's work, it's that same notion that those who are participating in the Photovoice project, their worldview, their ideologies, their experiences are such that it confers expertise in what they're observing, and that expertise should be honored, even if they may not have the credentialing, for example, of a research team or some other group that has come together to put a Photovoice project in place. So that's kind of the way that I see it. Susan, I'm sure you have additional thoughts, but yeah.
One of my most favorite philosophers. Paulo Freire is also noted with adult educator Miles Horton, and they have a seminal book called "We Make the Road by Walking." But Freire really saw and looked at disrupting the status quo with going back to the root causes to the problem. In that, he thought community members had significant lived experience about the real world, and that expertise far exceeded what we would often allude to other people who might have much more of an educational degree, as that they were experiencing the real world and were living in a real world, trying to provide for their families, trying to live. And so often what he would do, and which Photovoice is a Freire's theoretical foundation is part of the framework of Photovoice and the showed questioning methodology, is that you look at the question and you start with what is topically, what do we see right here? But then you go deeper. So you start to look at what is the picture saying, you know, how is it impacting our lives? What is going on? How does these circumstances or this photo here reflect back onto us? That you go down to the root cause to the problem. And once you know the root cause to the problem, then you can start to address that individually and within a group, because you don't want to just say, oh, well, that's just the way it is. Why is it that way? Well, because the landowner has dammed the water and I can't have any water for my crops and there's a drought. Well, why is that? So continually going back to the root cause. Photovoice also, one of the leanings that I've started to see is that there has been so much attention paid to the pictures in Photovoice, but for Freire, the pictures are just the trigger for the discussion. It is to open up and provide an opportunity for people to discuss their current realities and their lived experiences and move back to the root cause. So you have a very in-depth, rich conversation where a picture may be just a trigger to get people talking, for example, about having to balance roles between being an advocate and being a mother and providing for your family, or looking at how you need to go to work and live in a community, yet you can't afford to buy the groceries or pay the taxes in this area, or you might have to live in your car. So really what we're looking at is going back to the root causes to the issue and really empowering that whole cycle of critical consciousness and trying to break up the status quo and dismantle the oppression that exists within our current lives.
I just wanted to say I loved everything that Susan just said, and I really, really appreciated the point she made about the pictures serving as a catalyst for the discussion. And in that way, and I think it's important to note this, that's why the pictures themselves are a form of data, but it's really the discussions that emerge as a result of those pictures that's going to be the ammunition, so to speak, that will help compel or bring about the changes that we hope to see. The pictures are an articulation of what, or a way of displaying in a really kind of unequivocal manner what it is that people are experiencing, and that they serve as the jumping off point for a discussion about topics that people understand on an innate level, but might not even have the opportunity to reflect on because they have other things that they're navigating in life and don't maybe not have the space or the time to think about them the way that they could through a Photovoice project.
Great, thank you so much. Noel wanted to add, thank you for the wonderful presentation. The next question is, what kind of questions could we start with if we're interested in understanding the community resilience in light of the pandemic?
I'll let Chinema think on that for a minute because she's got an inquiring pose there. But I would actually start with, what does community resiliency mean? You know, trying to understand at the heart, how do people define what resiliency means? Does it mean individually? Does it mean something specific? I think that would be a great place to start. And often in the Photovoice trainings that will be held, you may have a question, a research question that you're looking at, and often we'll have a brainstorming activity. I never want to tell people what to take pictures of, but I want them to start thinking about the concept of what a picture could say, what a picture could symbolize. And so we'll have a brainstorming session. For example, what does community resiliency mean to you? And we'll just let people brainstorm their thoughts and their ideas. And then we'll also frame it. And then I will usually say, this is exactly the kinds of things I would like for you to take pictures of. Again, not pointing into anybody in an individual way. That's one of the ways I would start that, in thinking about that kind of a question. Chinma?
Yeah, you were right. I was thinking. I completely agree with you. And I was thinking very similarly that actually the first step is just defining what community resilience actually is and getting a baseline understanding of that concept from those that you are trying to learn about that concept from. So if, for example, you would like to understand community resilience from the perspective of community health workers, you would start off by, just asking them, well, how do you define it? Based on your definition, what has it looked like in your life or in the lives of those who you support, in the lives of your family members or friends or others in your, social network? And the more open-ended the question is, the more clarity you will get ultimately from them in terms of what that concept is. The stronger the concept will become in your mind, and the more that it will start to coalesce around a specific, theme. I also appreciated what Susan said about not wanting to enter into a Photovoice project being overly prescriptive about what the research questions are, what the topic is, because that really is the ideal way to do it. Even with the study that we did, the reason that we arrived at wanting to look at social risk factors is because over the years, we had heard a number of community health workers share privately their experiences helping someone access means-tested benefits, and then turning to us and asking us if we had jobs for them or if we knew of resources. And so I started to kind of vet the idea of community health workers' own issues around social risk factors with community health workers over a several-year period. By the time it came at the point where we did this Photovoice project, the foundation had already been laid in terms of the conversations that were had. And that was actually why I think that's why we were actually able to do it in a relatively short period of time. We had been building those relationships and those concepts over a multi-year period. And so I completely agree. And I think what that really harkens to is that some of what is done in Photovoice is born out of relationships. Having relationships with those that you are endeavoring to collaborate with in the Photovoice process. I mean, Susan is I hope she doesn't mind me saying this, but she's a great example of this. She's worked with community health workers. She's worked with community health advocates that's why, she has been able to do so many different and really interesting photo voice studies with those specific groups, because she has relationships with them. I've really tried to build the same kind of relationships with CHWs in Baltimore City. And you see these things and you see the papers come out, but these papers are products of years and years of friendships, of vulnerability, of bi-directional learning, and those sorts of things. But I think I went way beyond what you asked, but I still hope that helps in answering the question, because again, I think part of what will help you discern what questions to ask is understanding what particular needs your community has and the things that are of interest to them.
The one thing I would add, Jennifer, you're so sweet and so very kind and utterly brilliant. But the one thing I would also add is don't underestimate the creativity of the community. If given the opportunity to share, and if they feel that they are in a safe space with individuals who actually care about what they think about and what they say, you will have literally I had a 6-hour discussion group, and I promise it wasn't on purpose. It's just everybody felt so empowered in the discussion and that they were learning from one another, and had even described it as, I get a $25 gift card from participating in a focus group, but here I am learning from one another. And that, just allowing the creativity of the individual to really go out there and look at what you're talking about, and providing the support systems in place is also important. But I will also stress that you do also want individuals who are going to participate. So it can't just be a random sample. You really want individuals who are vested, who are knowledgeable about the issues you're talking about. And you're going to do like that snowball sampling to find who needs to participate. It can't just be John or Susie down the road. It has to be somebody who's really got a lot of knowledge, and you're tapping into that creativity and lived experience as well.
Mm-hmm. Oh, I just have to say, I could not agree with Susan more. And actually, when we were talking through what we wanted to discuss in this webinar, we were sharing our experiences of having these sessions that we thought would last for an hour that went way over just because people were talking. And that actually speaks to why we ended our presentation with these best practices. As you noticed, the best practices weren't things around the mechanics of you set your camera up this way or you do X, Y, and Z. It's all around the environment that you're creating for the participants and making sure that they feel affirmed in the process, that you, of course, are protecting your own boundaries, but that they feel comfortable sharing their experiences, and that you yourself are exhibiting the humility and modeling it in the way that you comport yourself during the photo voice process. And if you don't mind, I do see a question about how often they should take pictures and how to quantify it. And again, as I mentioned, we didn't really go into those specifics because that's really, a lot of that will depend on the nature of the project and what is most appropriate. Getting the culture of the group together and having that be strong is, in my opinion, and I think Susan would agree, that's probably the most important thing. If you have one picture, I've seen great photo voice studies where participants took one picture. In my study, they were told that they could take as many pictures as they wanted. However, because it was during the pandemic and it was all virtual, and because we couldn't take up like 3 hours, which sometimes it was getting to that point we had to stop it. We ended up saying, please just share like your top 5 pictures that you took. And you can take as many as you want, but just be prepared to go through the top 5. I have another colleague. Well, she's not just a colleague. She's actually my best friend. She did a photo voice project on food insecurity in Baltimore. And in her situation, it was done in person. She didn't restrict the number of images that people had to take. So, I mean, Susan, what was it like for you? Did you have to like give a limit?
I didn't give a limit either. And I will say both of mine were in person. And I think it just sort of depends. The first Photovoice project that I did was very early on. And so we utilized disposable cameras, and I wanted to share this just really briefly, if this might be helpful. In my first Photovoice project, I had very little attrition with the number of people who were invited to participate. I also utilized what I called a community consultant, an individual who was uniquely aware of the community and the individuals who I should include. And I paid them a consultant rate. And so back then, $100 an hour was really kind of high. And so I paid them that. And as a result, they helped me to find my location. They helped me to get the pictures back. You know, they got everything that I needed. And as a result, only one person in the 4 sites did not participate. And so just having that kind of an additional support staff was really important. And I should admit, my study was funded, so I acknowledge that piece of it, and I did have those resources. But having that individual, but in the first study, we gave them photo books to put their pictures in, and then we gave them index card to write what they were thinking. And at the beginning of our session, we would just do round robin sharing of pictures, and then they would pick one. And so that's kind of how we would start out. In the other particular project that we talked about, in the 2 subsequent projects, part of the session was done in native languages. I don't speak Vietnamese and I don't speak Swahili. And so they were led by trained and trusted facilitators and moderators, community health workers within those communities with those groups. So you have to be able to trust, again, that trust and relationship, trust and let go, because that's one of the biggest things about Photovoice is you can't control it, which I'm a control freak, but you can't control it. And you just have to trust that it will flow, and it does. It flows beautifully. And just the emotions that we would be crying, we would be laughing. I mean, they were just so beautiful. And I can't even express just the gratitude, because in one of the studies, they talked about the methodology as a theme, that people were asking about them for a change, and not just, how they liked something, but about how you as an individual are impacted by these things. And so that was asking about individuals' own perceptions and how it impacts them was really important as well. But usually we have to say at least 1 or 2 pictures, please. Usually it's the limit.
Great. Thank you both so much. We're going to work to wrap up since we're approaching 3 o'clock. Thank you again to both of our presenters with sharing your expertise and answering those questions for us. I'd like to give a special thanks to ASU's Office of Community Health, Engagement, and Resiliency, which is directed by Dr. Mary Ellen Brown, as well as the CDC, CCR staff and partners for their support and assistance with promotion and marketing of this webinar, and then each of our speakers and staff members who assisted with making today's webinar possible. There is an upcoming webinar on December 14th. Envision will be hosting a webinar focusing on Medicare CHW financial sustainability strategy. This webinar is open to all, and I will put the registration link in the chat. This presentation was supported by the cooperative agreement funded by the Centers for Disease Control and Prevention. Its contents are solely the responsibility of the presenters and do not necessarily represent the official views of the Centers for Disease Control and Prevention or the Department of Health and Human Services. You're going to see a short survey pop up on your screen. It might not pop up now. You might get it in the follow-up email, so please take that if you're able to. If you have any additional questions, you're welcome to send them to Dana Hunter, an investigator on this project. Her email is listed there. And then also Dr. Mary Ellen Brown, the primary investigator, her email is there as well. And then I'm going to add in the chat if you'd like to find out more about the work from Dr. Ibe and Dr. Mayfield-Johnson. I'm just going to send that really quickly. And to see some of the articles that they talked about today. I have one more link that I want to put in there. There's that. And one more link before I release you all. Here is the link to register for the Envision webinar next month. And with that, that wraps up the presentation today. Again, thank you to our presenters and thank you for everyone who attended. I hope you have a great rest of your day.